I'd like to call to order the North Fair Oaks Community Council. And if I could have a roll call, please.
Chair Linda Lopez,
Here.
Vice Chair Rafael Avendaño. Present. Councilmember Laura Kaplan.
Here.
Councilmember Beatrice Cerrillo.
Here.
Councilmember Mary Martinez.
Present.
Councilmember Dale Miller.
Here.
Councilmember Everardo Rodriguez.
Here.
Councilmember Esperanza Vasquez.
Present.
Youth Member Diane Zermeño.
Here.
And then alternate Youth Member Emily Cordova.
Here.
Okay, we will now, thank you, Irving. We will now have a public comment. This is the time that you have to make comment on anything that you don't see on the agenda, and we will give you 2 minutes at the podium. Gee, that podium's kind of far away, isn't it? Yeah. I wonder, can we? Yeah, we should get it closer.
They got it. What do you guys want?
Yeah. Yeah, I was gonna do that.
That's good? That's good. Thank you. Thank you.
And just jumping ahead well, no, I'll get there. Never mind. We'll finish this. So Janet Davis, you have actually 2, so you have 4 minutes. Oh, you want to do? Okay, which one are you talking? Oh, okay, sorry. So you have 1 public comment here.
Okay, I'm hoping that the North Fair Oaks Council could persuade the supervisors to cough up some money to give to legal aid to help people who are being evicted because their units are illegal. There's a case that I've cited several times that says that people who get evicted because they've been living in non-habitable premises can get all the back rent that they have paid. And I would like to see some of the people who are being ousted get help from legal aid. Thank you.
Thank you, Janet. Rosario Gonzalez? Are you Rosario?
Buenas noches.
Buenas noches.
Ah, ya.
Good evening.
Buenas noches. Yo soy residente de aquí de North Fair Oaks
I'm a resident here at North Fair Oaks,
y a mí me gustaría que ver que se completara ya la remodelación de la Middlefield,
I would like to see the Middlefield renovation completed.
porque yo pienso que ya se ha tardado mucho
I
en
think
planeación
it's
y
been delayed
muchos meetings
too long already in
y
planning, too
ya-
many meetings.
y yo creo que ya ha tomado mucho tiempo
It's taken a long time.
y yo creo que ya la comunidad merece que arreglen.
And I think the community deserves that be taken care of now.
And also, y también me gustaría que la biblioteca que tenemos aquí en North Fair Oaks
I would also like that the library we have here at North Fair Oaks
tuviera servicios más, un poco mejor de servicios en cuestión de tecnología,
that it have better services as far as technology is concerned.
porque yo veo que en otras bibliotecas, por ejemplo, de San Mateo,
I see that other libraries, for
otros
example, San Mateo,
lugares de aquí del área de la bahía,
other
tienen
places in the Bay Area,
servicios mejores en tecnología.
they
Por
have better technological services.
Uno de los ejemplos es, por ejemplo, que vas si quieres imprimir, por decir algo, fotografías o
For
algo
example, if you go and you want to print photographs or something similar
para las tareas de los niños y no puedes imprimirlos.
for the children's homework and you're unable to print.
Además de que ya como que han minimizado lo que es servicios de tutoría también.
It also seems that tutoring services have also been diminished.
Y a mí me gustaría que hubiera servicios que la comunidad necesita y que se merece.
I would like services that the community needs and it deserves.
porque estamos en un área donde la tecnología está cada día avanzando más y más y más, pero en North Fair Oaks no.
We're in an area where technology is advancing every day more and more and more, but not in Fair Oaks.
Y eso era todo.
And
Gracias.
that was all. Thank you.
Okay, thank you very much.
Gracias.
Gracias, señor.
Lynn,
Okay.
Is it appropriate to inform her or? Okay, all right.
But you know what, we have no, Rosario, no tenemos contacto, información de, necesitamos un email o teléfono o algo, okay? Thank you. Okay, approval of the, no other public comment? No. Approval of the minutes for January 28th.
Yeah.
Council, is it helping that you're getting these ahead of time?
Yes.
Yeah, everyone's, what is it, about a couple of days? Almost about 4 days prior to the meeting?
Yeah, usually I try to do them as quickly as possible and as early as possible. So usually, ideally, would be that Friday, but for this month, I had to submit it by Monday.
If no one has any changes or corrections, I'll entertain a motion to accept the meetings of January 28th.
I have a date for November 19th.
Yeah, I have November, but you.
Yeah, that was actually a typo. I just realized that it says November 19th instead
Okay,
of
so that's the
January.
wrong date.
Yeah, it's January
It should
28th.
be January 28th, right. 16.
One comment I had was about the public comment when this person came to report that he was having some issues right outside of his residence. And I think it would be good to note that also his concern was that he was in between jurisdictions, and that became a big problem too, because neither the Redwood City Police or the sheriffs, the county sheriffs, seemed to be able to help him at that point. So I'm sure this is going to come back again at some point with another person. So.
Thank you, Ever. When we get, Mike, when we get to county manager's report, can you comment on that? I don't know what was resolved but that's a good point, and that seemed to be the main issue for that person, was having to deal with two jurisdictions.
Right.
Okay? All right, thank you. Any other comments or changes or?
I think there's a typo on the street name here on page 3, is that correct?
Page 3?
Is it the left side?
On page 3. Oh, right, so page 3, under update on zoning, phase 2, second paragraph from the bottom, it's the spelling of Blenheim. It's a typo, it should be Blenheim, Blenheim. Thank you, Laura. Anything else? Yes,
I was absent the last meeting.
okay. So you should be under the absent list. Thanks, Diane. Okay, so at this point, I'll entertain a motion to accept the minutes of January 28th with corrections.
hang on. I'll motion that we accept the minutes with the correction to the date, Diane's absence, and the spelling of Blenheim. And the addition of the note of 2 jurisdictions in the public comment.
Okay. All right. Is there a second to the motion?
Second the motion.
Okay, all those in favor of the motion, please say aye.
Aye.
Any opposed? Okay, motion carries. All righty. Okay, item number 4, we just got word today, literally hours ago, that this was going to be taken off the agenda, so if any, the item is recommendation of off-street parking exception to allow 2 tandem parking spaces at 421 3rd Avenue. So this will not be discussed, there will not be any council action on this tonight. If anyone is here specifically for that item, we will let you make any public comments so we can take that comment and pass that on to the planner, okay? So, but what I need for you to do, though, is to fill this out. You can take it up there and fill it out, and you have the podium, okay? Yeah. And I think you're the only one, so, yeah. Oh, you can fill it out, you can go ahead and fill it out and, yeah, you can go ahead and make your comment. Yeah.
Can I have a
Yeah, sure.
translator?
Oh, okay, I'm sorry.
Hola,
Hola.
buenas noches. Bien, mi nombre es Isabel Torres y yo vivo, Isabel Torres,
Isabel Torres is my name.
y yo vivo en 465 Tercera Avenida
I live at 465 3rd Avenue.
y me gustaría saber más sobre lo que quieren hacer al lado de mi casa.
And I would like to know more about what's wanting to be done next to my house.
Eso es todo.
That's all.
Gracias.
Thank
Okay,
you.
so could you make sure we have, señora, por favor, tu nombre, dirección y un teléfono?
Sí, claro.
Okay, para hacer comunicación, okay?
Sí, muchas gracias.
Gracias, señora. So the only, well, we were hoping to get that information tonight, but it will be, I believe, on the March calendar? We don't know.
No, we don't know.
Okay. So, señora, ahorita no sabemos si vamos a poner en el calendario de marzo, no sé cuándo, pero el departamento no está listo para hacer una presentación de esta situación. So, no tenemos información aquí, no. Ahorita no. Después sí, pero ahorita no. Okay, all right. Okay, gracias. Okay, next on the agenda, a presentation on strategies for building healthy, equitable communities initiative. And is Shireen here? Oh, there she is. Shireen Malika Vasali from the Health Department is going to give us a presentation. I'm sorry if I messed up your name. Haven't seen you in a while, but the podium is yours, okay? Absolutely, absolutely. Oh, boy. Have I seen her? Oh, yeah, I know. Yeah, she's good.
It looks like, yes.
Oh, no, I haven't seen that. Thank you. Wow. Nice.
might stand over here since I need to
Okay.
navigate the slides.
Okay. Well, I mean, if you're more comfortable, sit, please. Whatever's
Okay.
comfortable, okay?
Okay, thank you. I think I'll be okay. Thank you, though. Maybe I will sit. I'm awkward enough at 9.5 months pregnant. My name is Shireen Malik-Kavzali. As Chair Lopez mentioned, thank you, Chair Lopez, Vice Chair Avendando, and members of the North Fair Oaks Community Council for having me here. I'm the Senior Manager for Health Policy, Planning, and Equity with the San Mateo County Health System. I'm here in my role as the Health Services Manager that oversees our epidemiologists for the health system, as well as a program called Health Policy and Planning within the health system. And I'll tell you a little bit more about that program as a whole. And particularly important for this presentation is the fact that the Health Policy and Planning program facilitates a community collaborative called Get Healthy San Mateo County. I'm here today to share with you a broad overview of Get Healthy San Mateo County's new strategic plan that was recently put together based on deep community participation. Just a little bit of background for those of you, how many of you have heard of Get Healthy San Mateo County Collaborative? Great. It's a collaborative of city, county, departments, city leaders, community-based organizations, residents, other leaders who are interested in advancing healthy, equitable communities throughout San Mateo County. The initiative has been around since 2004, and it was born out of the Board of Supervisors with Supervisor Gibson's interest to prevent childhood obesity and eliminate health disparities at a time when these issues were really bubbling up for San Mateo County, as well as being understood within the field of public health. During that time, through deep work with the community, a blueprint was developed to advance the work between 2004 and 2010. And in 2010, a new strategic plan was released to focus the attention and achievement of the goals of the program through a focus on food access, healthy foods, as well as building and improving physical activity opportunities. That strategic plan went from 2010 to 2015, and so quickly in 2014, we started to go to the community and ask, well, what are your interests now? What are the impacts on your health right now, in order to be able to develop the next iteration and goals for the Get Healthy San Mateo County initiative? And we recently, in October, released the strategies to build healthy, equitable San Mateo County. And the document that I passed around is a summary of what was identified through our community participatory and data research process, which I'll describe a little bit more going forward. Just to place you, because I know you guys interact with the health system in lots of different ways. In particular, you're right next to the North Fair Oaks Clinic as well. To place where our program in health policy and planning and this Get Healthy San Mateo County initiative live, I put together a quick slide that shares with you that the majority of the health system resources, infrastructure is focused on treatment and ongoing support. The clinics, the hospital, the focus on ensuring that everyone has the right service at the right time and people can be healthy and get healthy once they become ill. We also have preventative services and a specific focus on prevention, so ensuring that people can go to clinics and get checkups before they're ill in order to prevent illness from happening in the first place through services, screenings, and early education. Then we have a focus on educating people. We do cooking demonstrations. We pass out flyers. We hold workshops to share with people how their individual behaviors can be improved to support better health outcomes for themselves and their families. And then finally, this small layer is focused on place and policy, which is where the Get Healthy San Mateo County Collaborative comes in. we focus on creating environments that facilitate health and opportunities for everyone to be healthy. And what that looks like is creating systems change and making sure the healthy choice is the easy choice. So for example, how many of you in this room, let's say walking, if you could walk to work and that was the fastest way, the cheapest way, and the easiest way for you to get to work, how many of you would walk to work? How many of you currently walk to work? Okay. So making the healthy choice, the choice that everyone would prefer to make, the easiest choice, is really what we try to facilitate through the Healthy San Mateo County Initiative. So the mission of the collaborative is to support policy change to prevent disease and ensure everyone has equitable opportunities to live a long and healthy life. And so the focus here is on the equitable opportunities that everyone wants access to ensure that they can maximize the health in their lives. And the vision is that we'll be successful when all residents, regardless of income, race, ethnicity, age, ability, immigration status, or sexual orientation or gender, have the opportunity to reach their full potential, and recognition that you cannot reach your full potential without being at your full maximum health capacity. So when we look at health overall in San Mateo County, we have a lot of work to do still. 77% of our adults are overweight or obese. In fact, 1 in 3 children in San Mateo County are overweight or obese. 10% of adults have diabetes, and that number has been increasing over the last 15 years. Asthma, 18% have asthma, which has doubled over the last 20 years. And in fact, 2/3 of our youth continue to fail basic physical activity requirements. But with this, even with this challenge, what we find is across California counties, we rank fairly well as a healthy county overall. But part of the issue when you dig a little bit more surgically and you look at the data is you find that we have a lot of health inequities in San Mateo County. So this is one example of it, and in some ways it's a pretty egregious sample because it looks at mortality. So in San Mateo County, the average age of death overall is 77. When you look at the difference between Pacific Islanders and white populations, you find about an 18-year age difference. So there's something going on in relation to race across San Mateo County that is prohibiting the Pacific Islander community reaching their full potential for health. And we need to understand that more. And when you look across place as well as income, you find similar outcomes or disparities in outcomes. So for example, what we find that in East Palo Alto, the average age of death is 62 in comparison to Atherton, which is 81. So there's a 19-year age difference in average age of death between these two locales just in our neighborhood. So there's something that we need to better understand about place, income, and race that's facilitating either maximizing your health opportunities or needing more health opportunities. So with that focus and understanding of the data, one of the frameworks for Get Healthy San Mateo County is a focus on advancing health equity to ensure that everyone has equitable opportunities to live long and healthy lives. We also focus on place-based prevention. As you noticed, the specifics in place when you look at the average age of death, what you find is that often lots of different chronic diseases in particular shake out that way, that different geographies have different focuses, and actually some geographies have more health issues layered upon health issues than other places. And we have a deep belief in collaboration and partnership, and I'd say it's for 2 reasons. One is out of sheer necessity. The issues we have to deal with tactically are often led by lots of other folks, and it's a really big agenda, and no one can hold it on their own, so we all need to partner and work together to advance the mission. But it's also a value that we hold, because what we know is that community members, community leaders who work closest in their communities know their communities best. They know the issues and the challenges and the aspirations that people are facing and can speak to those directly, can speak to them well, and they've identified what their needs are and their wishes for the future. And so collaboration is really a deep value for us to advance through our work. So with that framework in mind, we went into a strategic planning process at the tail end of 2014 that held, I would say, sort of a three-pronged approach: deep community participation, a review and looking deeply at data and research, and finally looking at best practices. So one of the things we did is we held workshops, 5 workshops geographically diverse across San Mateo County. We asked people to envision what a healthy, equitable community looked like. And literally people just shouted out what they needed in San Mateo County to live healthy, long lives. We drew them up there. And then we worked to, at the tail end of those meetings, to identify what some of those key components that they envisioned and they wanted for their communities were. And remarkably, across 5 geographies from, the Pacific Coast up to South San Francisco, Redwood City, San Mateo, what we found was people's vision is remarkably similar. People want the same things. And we developed the 10 components of healthy, equitable communities based on that feedback, and then went back and did a community prioritization process where we had surveys in 5 different languages. We held focus groups and did paper surveys in order to ensure that the outcomes that we got and the participation was relative to the demographics of our county. And the community prioritization process identified 4 key priorities for healthy, equitable communities. And then we looked at our health data as well. We looked at health data, we looked at what was going on in San Mateo County, across the Bay Area, some of which I shared with you. We then reviewed best practices. We met with other health departments across the Bay Area who were doing similar work. We also met with national leaders on this work, funders, the Centers for Disease Control and Prevention, really looking at who was in the business of really thinking deeply about healthy, equitable communities, and what was it that they thought was important to address, and how are they addressing the issues our communities raised as a priority. So the 10 components that folks in our came up with, and we had over 400 participants, what is outlined in page 10 and 11 of your booklet in a much finer and more interesting way than what's up on the screen, so I encourage you to take a look at it. So they identified 10 components, anything from a focus on stable and affordable housing and a thriving economy, to safe and diverse public places, a sense of belonging in a community, clean environments, and community-based public services. The 4 priorities that were prioritized, or 4 components that were prioritized, are outlined in page 12 and 13. They include stable and affordable housing that protects health and provides ability to engage in healthy opportunities, complete neighborhoods that make it easy for residents to be healthy every day in their communities, making the healthy choice the easy choice, access to high-quality education in healthy places and schools, which create pathways to better health, and a strong local economy that builds household financial security for all. And there's lots of ways in which all of these 4 components directly and indirectly impact health outcomes. Just to sprinkle a few numbers out there, you can certainly look. Each of the priorities get a 2-page centerfold, so you can take a look more deeply at the numbers as well as the strategies for addressing those issues. But I'll just mention that, for example, the Centers for Disease Control and Prevention has identified that about 6 million homes across the United States are placing children at high risk for health problems and issues. 54% of San Mateo County residents are not getting their daily levels of physical activity. We have disparities. For example, if you have a high school education or less, you have a 1 in 7 chance of getting diabetes, whereas if you have more than a high school education, you have 1 in 11 chances of getting diabetes. So your chances for diseases are of not getting diseases is better if you have more and high education. And I shared with you a little bit about the economic differences in outcomes in relation to place. For example, East Palo Alto's median income is $54,000 versus Atherton, which is $241,000, which also shares in why there might be an average age of death difference of about 19 years. So I'll let you look more in depth at the document for more information on the priorities, and certainly happy to come back at a later time to share more with you, but I know you have a packed agenda today. I wanted to share just a few ways in which we have worked in North Fair Oaks directly in relation to our previous strategic plan as well as our current strategic priorities. One is that we've been supportive of the North Fair Oaks planning process. We've also been deeply engaged in the previous work around the community plan, in fact, which includes a health element within that plan, and continue to support the progress of that work and the implementation of those policies as bears interest to the council and the community. We have been supportive of promoting safe streets and increased physical activity through, again, the community leaders here on the ground, like the Siena Youth Center, who's done amazing work with the bike rodeo, with the youth identifying safe bike paths, and really getting out on the streets. We've supported healthy food access by supporting organizations that work with youth and faith-based organizations to ensure that people have access to healthy local foods. We have supported organizations in facilitating a community process to identify ways to access increase parks and community gardens within North Fair Oaks. We've been actively engaged in the North Fair Oaks Forward Parking and Zoning Work Group, bringing in planning expertise related to land use, how do you facilitate healthy food vendors, for example, how do you create safe streets and crosswalks and things like that. We've also been very engaged in outreach work of the North Fair Oaks work with supporting health messaging within the newsletter and supporting connections to other types of health education. So these are just a few ways in which we've been engaged in North Fair Oaks, but we welcome new and different ideas and certainly would love to engage more in whatever ways you see fit. The way in which we overall focus our attention and do our work and achieve those outcomes we want is through a policy planning, research and capacity building framework. So while we can do some education and certainly do, our strong suits is in advancing and supporting policy change, so doing urban planning processes that enable those types of changes within the system, and then thinking about what research is needed and what capacity building is needed within local leadership and technical support in order to be able to increase healthy opportunities and the vision and aspirations of community members. So with that, I will, I'm not actually sure, do we have any time, Irving, for questions? Yeah?
Yes,
Okay,
yes.
thank you. Thank you, Chair Lopez.
So, Shireen, we'll start with questions from council, and then I'll open it up to the public.
Perfect, thank you.
Thank you very much. Thank you. Comments, questions about the presentation?
I have a question.
Okay.
Thank you very much for your presentation and for making the effort.
Thank you.
I wonder if you guys work directly with schools, and how do you, and also how you do outreach to the general public.
Thank you. We do work directly with schools. A lot of our work has related to school wellness policies within school districts. And we also have a partnership with the County Office of Education to facilitate an overall school wellness alliance across the school districts to advance school wellness within schools. So every school now has to have a school wellness policy, but many don't know how to do it. It's actually a federal requirement in order for them to access federal funds for free and reduced lunch and so forth. But many actually just have never done this type of policy before, so they don't know how to write it or implement it, so we've been providing supports to the districts as well as individual schools to do that work. We hold the School Wellness Alliance as another way of bringing folks together for learning opportunities. In fact, we have an event, a School Wellness Policy Alliance meeting today. We had it. I was going to invite you tomorrow, but we had it today. We brought people together to think about mental health opportunities and challenges for youth within San Mateo County schools. We've also worked individually with schools and gone to them with ideas and supports. We supported community gardens within school systems, directly across districts or directly with schools. This gives you a little bit of a sample of the kinds of things that we've done. And your second question was
if you do direct outreach to the general public.
We do in some ways, though I think we have a newsletter that is open to anyone who wants to sign up. We have, in fact, we try hard to get to a more general public that we don't necessarily have outreach to, who's not coming to us and signing up for our newsletter. For example, are any of you familiar with the Silver Dragon exercise? It's an emergency, our emergency services runs a program where they in fact go to 16,000 residents directly to their homes and engage them in what would happen to their health and support systems if in case an emergency came up. So we take those opportunities to include informational materials, magnets, and a link back to where they can get more information about this broader type of work.
Thank you.
Thank you.
Shireen, how you doing?
Good.
Thank you for being here.
Thank you so much for having us.
Yeah, I really like how this is explained in a nice, friendly way, because policy is confusing. And that's my question, is this document in Spanish?
No, and I think it's a really good point. We've in fact had on our agenda to do, to translate, not a full translation of this, but a translation of a summary version of this. And I think it's a really good thing for you to remind us that we should put that top of our priority going forward.
The next question is, just piggybacking off what Ever said, is there educators that can help push forth these policy changes? And if not, how can we learn how to do that?
We would certainly be, so I think some of what because these arenas are so much out of, not all of them are within the purview of health, we look to partner with our key allies, other county departments like planning, like housing, to find out where we bring strengths and additional capacity and supports to advance these goals that they are aligned and they share. And sometimes that also works with community leaders who have ideas and access and ways in which they'd like to move things forward. And we find ways through conversations to figure out how can we be supportive of that vision of which we share together here. We often also outreach directly to city council members as well as cities directly. We have relationships with city managers and other city planners, for example. They'll reach out to us with an interest in better understanding how can they promote active transportation, what's the relationship between housing stability and health, and we'll often do memos for them, sharing the connections, identifying specific policies. We'll even do research, for example. We recently had a city asking us to better understand their profile of low-wage workers in order for the city council to be able to better assess the implications of certain policies on their work. So what we were able to do is bring that sort of technical supports in the background that enable the city to shine and move forward, and we're happy to do that with any community groups and with any cities or in support of other county departments and their interests.
Yeah, and I think that goes into the next thing is what can we do as a community and also as a council to push forth these great findings? Because this takes a lot of time. And how long did it actually take you guys to create this?
I would say it's a co-creation with the community because honestly, the thing that took the longest amount of time was engaging with the community, learning from the community about what the key issues were, and then looking across the diversity of what we have in San Mateo County, from the East Palo Alto to the Athertons that I mentioned, to figure out what are the issues that cross each of the boundaries and need to be addressed most urgently. I would say that really was the bulk of it. And then, we were certainly aware and looking at the data. So overall, as far as the document goes, I couldn't tell you, but it probably took us longer than we wanted it to. But certainly the bulk of the time was identifying and, surveying and prioritizing with community groups.
See, and we want to respect that work and not recreate a wheel that's already been created as a community. So yeah, just please send us ideas of how we as a community, as a council, can push forward with these, great findings.
I would really be curious to hear where your interests lie in alignment with these 4 priorities in particular, but certainly with the 10. And in fact, in that way, we could better do some research for you and come back to you with some ideas and thoughts of how we can support your interests that align with what's been prioritized here.
Laura, you wanted to follow up something?
Yeah, I also had a follow-up to Ever's question about the schools. You mentioned working with the schools on their wellness programs. I'm not sure exactly what all that involves, but I was just curious. I think you said something about school lunches. So to me, that's kind of a big area, and I know there's been a lot of discussion on a national basis about that, and I don't know where we are locally, but is there some involvement or direction taking place with regard to, what's being offered to children in schools, not just in lunches, but just what's available to them on campus?
There is. There's a lot of discussion, and I think there's also a lot of barriers. So we've been in conversations with food service directors who handle much of what you talked about, which is the purchasing and the implementation of breakfast, lunch, snack programs within the school districts. And there are a lot of barriers, but there's a lot of momentum and moving forward. We're in fact working with a community partner this year, which we will just start, to see how we can work to locally source food, healthy foods within schools, for both to grow the agricultural opportunities and the economy and the environment in the county, as well as ensure that schools and children have the healthiest food possible, and hopefully at a much cheaper price because it's just coming from our own farms just down the street. So we have a year-long partnership which will be helping us figure that out a little bit more, bringing food service managers together across school districts to sit together and identify the barriers and identify some solutions around that work. We also, one of the things I forgot to mention, so school wellness policies do dictate some things around the types of food and nutrition that should be available, though they could go further. And so what we do is support the schools in identifying what policies they should have in place, and then how do they actually robustly implement them, which is where oftentimes schools fall short because they're just dragged in so many different directions. So we bring best practices to them from other districts, from other local groups, and we'll make connections between different schools, for example, that are doing it well and some that need support in the same areas. I also forgot to mention that sort of a new arena that we're partnering with the school district on, the San Mateo County, San Mateo Foster City Middle School District, to look at restorative practices. I don't know how many of you have heard of that. It's essentially I'm not going to do it justice, but the idea is to have a supportive system when youth fall into some key traps over and over with disciplinary policies, and often end up getting them expelled or getting them sent home for the day or 2 days or a week, and taking them out of the educational system over and over again, that ultimately then slows down their educational opportunities for a high school education. So we're working with them on this particular practice.
Yeah, and that's a terrible cycle.
Yeah.
Because the kid becomes stigmatized, the kid, it's just a terrible cycle, ends up with way too much contact with the system
And get so
yeah.
discouraged.
So I'm glad to hear you're doing some, that you're looking at that area. That's great.
I have a question.
I
Linda.
just.
Oh, when you're done, I have a question.
I just want to make a comment, Shireen, and I know you've been working on this I haven't seen you for a while, but this is what.
I've been busy.
This is what you've been doing. But just at a glance.
Uh-huh.
This really mirrors the Fair Oaks Community Plan in all aspects.
Yep.
So that's great. So we know we're all on track. It's now a matter of getting the commitments and the collaboration. Because I know if you don't have, say, for example, the school system, and I'm just talking about the regular system, I'm not even talking about charter schools. But if you don't have that commitment at the superintendent level, it's not going to trickle down. I mean, it's just not going to happen. So
That's
I
right.
know it's a big task, but it's worth it, absolutely worth it. But I'm glad to see this. It's a really good report that you've come up with.
And I'll mention just, in addition to the report, if you go to our website, we have indicators related to each of the 4 priorities that actually give you data and maps. Usually each of the indicators, we have about 30 indicators and data up on our website, which give you maps and information on baseline conditions related to the 4 priorities, so you can see how well San Mateo County is doing currently in relation to the priorities that the community identified.
So we're going to take Mary, you
Yeah,
have a
just-
question,
yeah,
and then
quick
we're going to
question,
open
yeah.
it up. Yeah.
So, are there any community events coming up anytime soon?
We will have what we call a biannual, which is really not that engaging. We need to find a better name for it. Get Healthy San Mateo County collaborative meeting coming up in the spring at some point. We don't have a date for it quite yet, but we will certainly be sure to let the council know through Irving and others so that you could participate and in fact share that with your community members.
Okay, is there anything any type of event where you get the actual community involved, so getting the kids involved, getting the parents involved?
We don't do as much direct service
Okay.
as, if you recall, the sort of ladder that we fall in. We rely heavily on our other health system partners who work much more directly with,
Okay.
for example, BHRS Behavioral Health Services works really closely with those with mental health disabilities, those with alcohol and other drug issues, and really builds their leadership. We'll connect with them directly to better understand and how we can support that particular population, or family health who might have services like WIC or otherwise that directly work with families. For ourselves, we are a small group and we don't do a ton of direct engagement. We support the engagement like through leadership like you have with the North Fair Oaks Forward and bringing a health message to these tables, but ourselves, we don't organize large just community-based events, though we do actually support them, provide resources and supports for them.
That's great, thank you.
If there's no, okay.
I have one last
Yeah,
question.
sure. Yes, absolutely.
Would it be safe to assume that this information eventually trickles down to the community clinics and the health providers?
That is certainly our hope, yes. I've been doing presentations internally as well as externally to better inform how this broader community-based process can inform our providers, can inform, just as an example, I just gave a presentation a couple weeks back to the First Five Commission. And just before I went up, they had an evaluation. They had been assessing their most vulnerable people they provide services to at the most vulnerable levels, and their number 1 and number 2 top issues were also reflected in the top 4 priorities of the plan. So even though we often are not working directly with those, the patients themselves. We are in direct alignment with the issues that they're facing.
Thank you. Does anyone in the audience have a comment regarding? Yes, Janet, would you take the podium, please? Yes.
I had a comment and a question.
Okay.
The comment is that.
Oh.
The comment is a funny thing I read in the paper the other day, that Atherton requires almost 2 acres for a chicken, which I thought was funny. The question is, what does your department do about mold, lead, and asbestos? Do you coordinate with planning or with code enforcement or who? Because I went to a place where I'm darn certain there was black mold all over the place this last weekend, and I wonder how you get involved in that.
I think the question was that how your department is working on issues around lead and mold, some of those, I guess, what do you call those, environmental hazards that affect health, yeah, and life.
Those are really critical health issues related to housing, habitability, very basic level habitability of housing, and our environmental health. So our partners in environmental health, which is a different division of the health system, deals directly with those types of environmental health issues and does inspections and habitability analyses, both proactively as well as reactively in relation to people calling in with complaints and otherwise.
It's
the
actually
way,
part of one of your priorities.
yeah, the way,
You have a section here under Health Connection where
yeah,
you speak to that, so
yeah.
I can make sure you get a copy of this, Jen. Okay, thank you, Shireen. Any
Sorry.
other comments from the public regarding the presentation? No. Well, I think that is it, and thank you very much, and good to see you. And so I just had one ending comment. I think that, is this distribution of this particular booklet more for organizations and, or, I mean, is this for the general public?
We'll give it to whoever wants
Okay,
it and whoever wants to
because-
give it away.
So then you may consider getting the entire document translated.
Okay.
I mean, to do a summary is nice, but the entire document is really important. So, and it's, to do a summary is one thing, but I don't think it's going to be that much more to do the entire booklet. It's just a suggestion.
Thank you very much
Yeah.
for that feedback.
Yeah.
Thank you.
Yeah.
And thank you so much,
Thank you very
Council,
much.
for having me here. I appreciate the opportunity.
And good luck on the delivery. I wish
Thank
you
you.
well.
I will need
Wish you
it.
well. So we are now at the reports to council, and we'll start off with supervisor's report.
Good evening, council members, Mike Hallegy, Melissa, members of the public. My name is Irving Torres. I'm a legislative aide to Supervisor Warren Slocum, and I'm going to be reporting tonight. So the first item that I want to present to the council is that on March 19th, the San Mateo Youth Commission is going to have their annual youth conference, and so that is from 10 a.m. to 4 p.m. It's open to all youth members and also advocates of youth as well. So it's open to everyone. So there's tons of workshops regarding that message. And what I'll do, council members, is I'll send a link tomorrow with more details in terms of location, as well as how you can sign up if you're interested in attending the San Mateo County Youth Conference. Another item that I wanted to present to the council is actually on that Saturday, March 19th. We are in collaboration with HSA to host a citizenship workshop. As you recall, we had one in the Redwood City / North Fair Oaks region. This time around, we are going to be reaching out to Menlo Park / EPA residents. And so that's going to be at Castaño Elementary School. And so that's going to be from 9 a.m. to noon. And I'll send details as well, council. We're looking for people that would be able to sign up to volunteer as well to help with the intake process.
There's no stipend for that?
No stipend for the
Volunteer.
Yeah, I mean, we'll provide some lunches and some snacks for the ones that participate. You'll also need to, if you do sign up to volunteer, you also need to do a training. We collaborate with an organization that usually handles these types of citizenship workshops. So they do a pre-training for those volunteers so that way they understand the intake process and so forth. And then also an announcement, Recycle Works actually has a volunteer academy in the series. It's no cost. It's basically a couple of workshops / webinars related to sustainability and resource. The first introductory webinar will start on March 3rd from 11 a.m. to 1 p.m. And I'll send a link to the council as well with some more information and who to contact specifically from the Recycle Works department. Just also a reminder to the council members, May 21st, I know this is ahead of schedule, but May 21st is going to be the fifth annual OIA conference, which is the Latino Youth Conference. It's going to be held at Kenyatta College. Terry Chin, as well as Carmelo Meehan from the North Fair Oaks Youth Initiative, is going to come next month to present to the council members with some more information about the conference. And hopefully some of the council members would be involved in that process as well. And so that is all I have to report for tonight. I'll be happy to answer any questions.
I have a question. For the HSA Citizen Workshops, you said it's only open to East Palo Alto and Menlo Park residents?
It's pretty much open to anybody, but HSA is actually going to be sending out like a letter for those who are going to be eligible because we're going to give a free waiver. We're going to waive off the $600 for the initial process. And so, so we are actually sending out mailing under HSA for the people who actually are eligible to receive those. Well, we're not going to exclude anybody that comes. So it's just that they might not be eligible to receive that waiver. But it's open to whoever comes on that specific day.
Great work on that.
So we'll all.
That's huge,
big.
the waiver?
Yeah, and so for those that have questions, you know, we'll also connect them, you know, to the organization, to the institute that coordinates these, so they can even meet with those people one-on-one. So, so if you have anybody, Mary, any parents that need some resources, just send me an email so that way I can connect you to that specific person who handles that.
Okay.
Can you get kind of like an information flyer or something if we do have groups that do deal with a lot of families, so we can get that information out for that meeting and what they need to do in order to qualify?
Yeah, I'll send out kind of like a generic flyer that like HSA has created. I'll also send out kind of what the organization usually sends out as well. I mean, they're going to be the direct contact. We don't know the anticipation, so we don't want it to make, you know, it's going to be a first come, first served basis just due to the capacity level. We don't know the expectations. We're going to be sending out a mailing to about 1,500 plus people. So, you know, it just depends on that day in terms of capacity. So ideally, what would be beneficial is that I would just connect you to the specific coordinator from that organization who can follow up with that constituent later on.
Okay. Thank you, Irving.
Thank you.
Okay, we have Deputy County Manager's report.
Madam Chair, council members, thank you very much. North Fair Oaks 4 team has been extremely busy, and I'm pleased to announce that we've hired our third member back, so that's Victor Gayton. And I'm going to ask Victor to come on up. He's I think, very familiar to the North Fair Oaks community. He's been around this community for a long time. So, Victor, do you want to mind coming up and telling the community a little bit about yourself?
Of course. Hi, my name is Victor Gaitan, and I'm the newest outreach coordinator for the North Fair Oaks Forward. I've been working in North Fair Oaks for a couple years now. Used to work with the International Institute of the Bay Area right here in the Fair Oaks Community Center. And last year I was festival coordinator with the North Fair Oaks Community Festival. Helped coordinate all of the exhibitors for the festival. So I've been working with the community for a while now, and I'm looking forward to helping out as much as I can with North Fair Oaks Forward. Thank you.
Thank you very much, Victor.
Thank you.
We are very lucky to have Victor on the team. I did want to talk a little bit about the Middlefield Road redesign. I know a community member brought that up. I just want to assure the community that work is still continuing, even though the steering committee is not moving ahead right now. The AECOM team is still looking at the road redesign, specifically around the railroad crossing. They're looking at the undergrounding of the telephone lines along Middlefield. So work is still going on behind the scene. Now, with the steering committee, we have been in negotiations with a couple contractors, and we have secured a contractor to come in and talk with the steering committee about gentrification and displacement. And we're very excited that Richard Ford, he's a professor at Stanford, and a professor in the law school at Stanford, has agreed to come and meet with the community members on the steering committee, provide some education as to exactly what some of the causes are around gentrification and displacement, and elicit some feedback from them so we can address those concerns. We fully expect the steering committee to be back on track and moving forward in early to mid-April. So we're going to have a couple of sessions with Mr. Ford, and then we're going to reconvene the steering committee with AECOM and start moving forward for the road redesign. So we're very excited about moving forward. But the other part of that is parking solutions. That was something that the steering committee was also very concerned about. We continue to look for solutions. As you know, the road diet may eliminate 40, 50 parking spaces along Middlefield Road, so we're continuing to look for alternative parking locations. We have been in contact with SFPUC, that parcel at Huntington and Berkshire, and we're trying to initiate negotiations to try to secure that piece of property. That's just one piece of land we're looking at. And Public Works has, I believe, now hired the consultant. I don't have the name of them, but I believe they were hired the other day, that will do the parking study on Middlefield Road so we really understand the times and locations where most of the traffic is generated and where most of the parking needs need to be met along Middlefield Road. So that'll be an ongoing study, and by our next meeting, I'll have more information for you about that. The zoning work group, as you remember, they postponed the ferry meeting, and it will resume. They will resume their meetings next Tuesday, March 1st at 6:30 in the Fair Oaks Health Center. And this is to discuss Phase 2A of the commercial mixed-use district rezoning. So if you have any questions on that, please feel free to contact Will Gibson of the Planning Department. Illegal dumping. A lot is going on with illegal dumping in North Fair Oaks. Jennifer's taking the lead on that, and she's doing a fantastic job. Really doing outreach. We've identified, and we're going to get very specific with the council in the future as to some of the behind-the-scene things we're doing and some of the locations that we've identified. But to expedite this tonight, I'm just going to say that we've identified some locations that we believe a lot of the illegal dumping is being generated from particular apartment buildings. We're working with those owners, operators of those apartment buildings for alternative means of disposing of unwanted property. We're also looking at an Adopt a Block program, and code compliance is in the process. We've identified, but they're in the process of installing 4 more cameras, which has been very successful. On the one camera we have up, 4 more cameras at very specific locations targeting illegal dumping. The 1 camera location that we have up now has resulted in no illegal dumping since the camera's been installed. And we have, again, increased our efforts on outreach and education on the illegal dumping. We'll continue to do that. Excuse me. Business sustainability plan, very important to the Middlefield Road redesign. We're in the process now of reaching out to other jurisdictions who have undergone redesigns and road closures in business districts. And we're going to use, we're going to talk to them and lessons learned from them and use their RFP to go out and hire an expert in the area so we can really put a very firm game plan together before we start that redesign process. Public art, the fourth utility box mural at Fifth and Waverly is in progress. Good to report. And the damaged entrance sign on 8th Avenue, we decided we can't fix it, we need to replace it. So we're just going to go ahead and replace it. We want it to look, if we try to fix it, it just won't turn out right. We've tried every means possible. So it's really, the only real solution is to replace it. We're going to go ahead and do that. I just want to talk a little bit about the NRT, the Neighborhood Response Team. We continue to meet on a monthly basis. And just a reminder to the public and to the council that this is a multidisciplinary team made up of the sheriff, code compliance, public works, the Office of Sustainability, county council, public health, of course D4, the county manager's office, and our latest addition has been the district attorney's office. You know, we invited Ms. Davis to our last meeting. She was a guest, I got to tell you, I'm just so impressed the way all the departments have come together and leveraging the resources and working together, all focused on North Fair Oaks. It's amazing the work they're doing down there in code compliance, and I believe that Mr. Haas and Deputy Director Salza is here, and they'll talk a little bit about some of the things they're doing. But the code compliance aspect of what's going on down here now is terrific with all the pieces of the puzzle in place, and I'll let them talk a little bit about that. And then Councilmember Rodriguez asked about the gentleman who talked about the drinking going on in front of his house. Sergeant Patato really jumped on that after that last meeting. He sent resources out there. Then very next day, there were 3 gentlemen out there very early in the morning drinking in front of that gentleman's house. So he contacted him. He told him about the violations. He has continued, even though it's not in the sheriff's jurisdiction, he has informed them, call us anytime. They have been doing several passing checks there. We have sat down, the sheriff's office and county manager's office, D4, and we are working out a ABC violation strategic plan for North Fair Oaks. We're getting a list of all the locations with the ABC licenses. We want to cross-check that against those who are using resources in North Fair Oaks, you know, where we have drunk drivers coming out of individuals who are intoxicated, who are possibly urinating in public, or any of those type of things. And we're going to focus on those establishments with a multidisciplinary team, making sure that they come into compliance if they're out of compliance. So that is my report. If you have any questions, I'm happy to answer.
Go ahead, Laura.
Just regarding the, the meeting with the, what's it called, on the Middlefield Road, you said the consultants are coming to talk about
Gentrification?
Gentrification.
Yes.
Can we be notified of when those
Absolutely.
meetings occur in case we want to just be a fly on the wall?
Absolutely. This council will be informed of those dates along with the steering committee, and you're more than welcome to come.
Okay. That was actually one of my questions, but thank you for that. My question and somewhat of a concern is the number of cameras that you're installing in North Fair Oaks. It started with 1, so how many are there now? 4?
We will be looking at 4 other locations. They haven't been installed yet. We're looking at 4 others. And this is because these are the sites through See-Click Fix that we have noted that there's still prolific dumping going on there. And we believe that this is a very good tool to use to dissuade those who are going to illegally dump from dumping. It's worked in other communities. We've seen a dramatic drop-off in our own community with the use of this camera. And these cameras, I want to assure everybody, are very narrowly focused on the dumping location. They're not looking at any houses.
That's my concern.
Right,
is privacy.
Right.
I have a real issue about cameras all over. I mean.
Right.
And so we never really talked about it. We knew that there was going to be 1 installed, but I thought that there was going to maybe be some discussion at this end, or at this level, regarding the acceleration of that piece. But my other question is the education and prevention piece, where is it? Because when we started talking about illegal dumping years ago, I remember you guys sat over there and it was in a study session format. That was a big piece of the solution, and I'm not hearing that in the big picture, so.
Yeah, you're absolutely right. That is a big part of what we're doing, and
Yeah.
and I'll let Jennifer talk in depth about that in the study session. But suffice to say that that is a big component of what we're doing. Not only with going out with door hangers throughout the entire community to notify people that it is illegal, that there are going to be stiff fines. We're working on a revision of the ordinance, the illegal dumping ordinance. We're also, as we heard today in the study session, that Jennifer was with the group at the Sienna Center with C-Click Fix, showing them, and we're trying to get out and educate the youth of the community, so in the hopes that they'll work on their parents to make sure that the parents aren't illegal dumping. But then we're going to a block-by-block type of situation. We're also educating property owners and working out different ways for them to dispose of and to set aside on their property a location where people can, if they're moving out, put their mattresses, put their couches, put their dressers that they don't want, and we will come pick them up.
Yeah.
This is all part of the education component, and I certainly don't want to, I do want to underscore that that is probably the biggest component of illegal dumping strategy that we have going forward, is the ongoing education and partnering with the community to ensure that we get that message out.
Yeah, I really strongly believe that it's important that we go at it both,
Right.
at, both angles. For years, we have not had the enforcement piece, and it sounds like that's, coming together, but we still need to continue our work on the education part of it. So thank you for that.
Absolutely.
One other question I had, and it just, that's fine. You answered everything. Any other questions,
Yeah, I
Council?
just want to add,
Yes.
like with the restorative practice that you mentioned, in educating the communities about the illegal dumping. Sometimes people don't know, because especially if you're coming from a different country, and they're normally used to doing that, because
Right.
the city will handle it. That's the notion, right? So making sure that our youth are educated to pass on that message. It's another thing of picking up a garbage and throwing it. It's a discipline,
Yeah.
So I think that the restorative piece that you speak of, Linda, is really important. And whichever way that our youth can help in doing it, just let me know.
I'm very excited about the plan that Jennifer has in place and is moving forward with the youth, because I think that's where it needs to start and continue, and so they can help educate their parents. But that is a big component of what we're
I
going to do.
did have one other
Sure.
question, Kim. The collaboration with Recology, is that strong? Because one of the other issues that was brought up time and time again was the garbage situation at the apartment buildings, that the apartment buildings don't have sufficient garbage, what do you call those, receptacles or
Right.
whatever? So is that being fixed?
It absolutely is. The Office of Sustainability is looking at that in cooperation with our co-compliance unit to make sure that there are sufficient bins and dumpsters on property. And then we're working with our partners, Recology and others, on the mattress recycling program. Additionally, the Sheriff's Office has been terrific through their work furlough group, coming around twice a week and hitting the main areas and picking up illegally dumped items off the street. So we've seen a marked difference in the neighborhood. But we don't want the community to get used to that. We want the community to know that there's other means and the correct means of disposing of things.
Right. Janet, do you still want to comment? She submitted a public comment thing regarding your report.
I think this is going to be taken care of a little later. It was about commercial vehicles.
Oh,
And
okay.
so I'll wait until that happens.
Okay, all right.
If I may, through the chair, because I think that really falls under my presentation also. Commercial vehicles, as you know, has been, it's been difficult to deal with in North Fair Oaks. So taking up a lot of parking in the neighborhoods. We are prepared to move forward with the sheriff's office in abating those illegal vehicles that are parked on the street. And that's those vehicles with in excess of 10,000 gross pounds. So we, oh, great. So we have this notice that will be placed on, and I'll pass it around here. The sheriff's office will be placing this notice on those oversized vehicles in the neighborhood and giving them a 30-day warning period before citing those vehicles. So they need to move out of the neighborhoods and park into a commercial zone area or on a private lot.
I'm going to throw out an address, 5th and Glendale, Peninsula Catering.
We
have
will
taken over, literally taking over a residential area. I mean, you know Peninsula Catering, right? Yeah.
And that's exactly what we want. We want to.
There's like seven trucks, literally. I counted them.
We want the public to call us on those vehicles that are 10,000 pounds gross weight or more, and that's basically what we're looking at is more than a pickup truck, bigger than a pickup truck, we believe that it'll free up a lot of parking in the neighborhood.
Okay. All right, I think we're good. Thank you very much, Mike, for your report and a lot of things in progress. Thank you very much. Oh, planning and building.
Good evening, council, staff, and members of the public. I'm Lisa Awazasa. I'm the Deputy Director for Planning and Building, and I'm here to give you a brief update on some of the projects we're working on in North Fair Oaks. Specifically, I was asked to update you on our activities related to the Sports House facility, and I want to So Irving is passing out a letter there that I've provided, and I think I should have a few copies for the public as well. As most of you know, there were a lot of complaints and concerns about the activities at the Sports House back in the latter part of 2014 and early 2015. And there were, these concerns included excessive garbage, noise, traffic and parking, and the use of the facility for unauthorized stadium events. The December 12th letter to Sports House that is attached to the letter I've written to your council here, or we've written to your council, gives a lot of detail about the specific issues that came up at that time, and also the specific actions that were required, that Sports House was required to take to correct them. And those issues, for the most part, were addressed. I think the last of them was addressed in February or March of last year. And so, from our experience, they have completed what they were asked to do as part of that administrative review of their use permit. And so they've completed that, and as far as we know, things have been better. At least we have not been hearing complaints in the planning department. Now, if your council is still hearing from neighbors that there are concerns about the facility and their operations, there will be another administrative review in May of this year. So that would be a perfect time for us to investigate any additional concerns that folks have. Maybe the problems are creeping up again, or there are additional concerns that we can address. So that's coming up in May, and that would be a great time for folks to talk to us about what some of the issues are.
It might be a good, it's good to hear that a lot of the actions, the required actions actually took place. I would guess that if there are still concerns, they may be calling the sheriff, I don't know. But it'd be good to get some kind of feedback from the sheriff's department if they are getting any additional, concerns. Now, when the sheriff's department had their community dialogue, what was that, a couple of months ago, or actually last year? I don't know if that was one of the things that came up, but we might need to do some follow-up and see, because I don't think they would call your department, Lisa. I think they would probably contact the sheriff or Supervisor Slocum's office, correct? So,
Yeah, so when
so just
we,
to make sure everybody's happy right now,
Yeah, so as I say, we're not hearing anything, but that's why I'm kind of reaching
Right,
out to you.
exactly.
Let us know. And I specifically, it would be great if you could contact Summer Burleson, who's our project planner for that project. Her contact information is at the bottom of the letter there. So when she starts the review in May for the next round of the administrative review, that's one of the things that she'll do is, as you suggest, reach out to the sheriff, reach out to the council, find out what the concerns are and see what we need to address at that time. And then in addition, the permit is up for a complete renewal in 2017, I believe. So there should be a number of opportunities to address ongoing concerns. And then in addition, as Mike Callaghy has suggested, that we continue our efforts to deal with parking issues in the community. And I think some of those efforts will help with that, in the parking issues in that area as well.
Will there be a review that has anything to do with the council? I mean, will it come here at all? When you talk about the next county required administrative review, is that something that would be public here on the council agenda?
Yeah.
Okay.
Yeah, I believe so. I think that's, if I recall, that's how we did it last
Yes.
year.
Okay.
Yeah, so, you'll probably see us May or June of this year, again, with the next round of review.
Any questions?
I really appreciate the way you frame this document. It's really thorough. It allows us to really navigate it quickly and see where it was that our concerns and also the community's concerns were. So I appreciate the way this was developed.
I'll share that with Summer.
Oh, Summer did the form.
Yeah, and then we can certainly come back in May too with photos to kind of show you more specifically what they actually did with the signage and the planting and some of the other things. I was going to talk a little bit about our rezoning efforts, but Mike Callaghy sort of went over that. I will just say we're, as you know, we're continuing that work and working now on the area along El Camino and Fifth, continuing to work with the work group on a monthly basis. We'll be meeting again next week on March 1st, I believe it is, 6:30 at the Health Center. So anyone is welcome to participate in that discussion. It's a group of community folks and then development professionals that are working on zoning regulations for the El Camino and Fifth Avenue corridors as part of the implementation of the community plan. Also, with regard to code compliance, I'm pleased to report that we are now fully staffed. We have 5 code compliance officers, a senior officer, a code compliance manager, and dedicated administrative support for that unit. So we are at full steam.
Good.
So we've started to do some work specifically in the commercial areas. And as you mentioned, we're starting with outreach. We're not, going in there and starting to issue citations up and down. We're going in and trying to educate folks about what the regulations are with regard to signage and parking and all the other things that we regulate. So we're just starting that effort, and we think that's going to really help going out there and outreach, doing the outreach in person and speaking with the business owners to try and get ideally voluntary compliance before we have to actually do any enforcement. So that's up and running. And then finally, with regard to building, I just want to mention that our building inspection manager, Miles Hancock, will be working on an update to our building regulations this year, which might be something that you would be interested to learn more about. And I'd certainly be willing to arrange a time for him to come back and speak to you about some of the key issues that are will be involved with that update.
Yeah, we could use that, I think. Just keep ourselves updated on that, yeah.
And through the chair, if I just may add some to Lisa's comments. So just recently, code compliance has moved into the sheriff's substation, and we just think it's paramount that those two, the sheriff's office and code compliance, have a very, very close working relationship. So we're very happy to say that they are now up and operational out of the sheriff's office.
Great, great. Thank you very much, Lisa.
Okay, you're welcome.
Thank you.
Thanks. Okay, council member reports. And then we have discussion on secretary position, and then the election, new officers. So, council member reports, if you have any reports? You do? Okay, keep it brief.
All right, Siena Youth Center this week was awarded a Community Star for Youth and Community Programming from Redwood City 2020. So I just thought I'd share that with you all because you are all a reason for that. And the Full Forward came today to assist in Thursday's community cleanups with outreach staff Jennifer. I believe she'll be sharing some pictures of the kids cleaning up our streets and just advocating for change. And also, about 2 weeks ago, Siena Youth Center was spray painted with the words "Police Killer" on the side. And I got in touch with, along with Sister Christina, my executive director, with the county and the sheriffs, and they worked together to get the graffiti abatement team out there, and it's gone. So thank you to the county and thank you to the sheriffs, Todd Fanato and Public Works, all that. And today, Siena Youth Center announced, and this came up out of the blue because we have an amazing youth, the first ever inductee to the Siena Youth Center Wall of Fame for dedicated community service and pioneer. He's been with us for 3.5 years. Community service, demonstrating voice, choice, and leadership. And he's here today. His name is Juan. He's right here in the front. So he was elected into the first ever. Take off your hood. There you go. So he's the first ever inductee into the Siena Youth Center Hall of Fame. He's been with us since we opened in February 2012. He was the first kid that I met. And yeah, he's Hall of Fame.
All right, that's great. Congratulations. Are you in, what grade are you in? Junior. At what school? Woodside. Okay, congratulations. Any other council reports? No? Okay. All right, well, let's get into it here.
Sorry, I had.
Oh, yes, Diane.
So this Saturday, so this Saturday is the Dream Club conference at Sequoia High School. It's from 9 a.m. to 3 p.m. Wait, are you in the car? Okay, sorry. I don't know if there's a fee to get in. Does anybody do that?
Can
I don't think so.
Can you talk in the mic?
Oh, my
Yeah.
bad. Okay, so yeah, there's no fee. Okay, cool. Just want to make sure. So yeah, you just have to sign up online. Don't know the website, sorry. But it's the Sequoia High School's Dream Club Conference from 9 a.m. to 3 p.m. And then next Friday, March 4th, is the Sequoia Cheer Showcase. And it's our annual fundraiser to help out with the cost for girls on the team. It's $10 for general admission, and it's really fun. It's a cheer and dance exhibition from teams all over the Bay Area. And it's from 6 to 8:30. So, yeah.
Diane, I don't know if everybody knows who Dreamers are. Can you give a real brief definition of what that means?
So Dreamers are undocumented students, and at Sequoia High School, I know that our Dream Club puts on a lot of events in order to fundraise to, at the end of the year, give scholarships out to their students to be able to reach higher education.
Great. Thank you.
I have one last So the council really honors the work of Linda Lopez this past 2 years. She is an amazing mentor. She is an amazing person. I get emotional talking about her because she's a true pioneer of this community. And it's been an honor to sit next to her with all of you, to learn from her, to feel the heartbeat for the community with her. And Juan actually has something for you today as far for the council, from the council. We got you some flowers, and we got you some gear to make you more happier than you already are for this community.
Wow.
Juan?
Wow, I'm surprised. Thank you. I'm surprised. Thank you. Oh, thank you. So he hears the heartbeat and sometimes the elbow, a little elbow right there. Thank you so much. Wow. Springtime, beautiful, beautiful. Whoa, that is wonderful. That is wonderful. I have had a wonderful 2 years here. Wonderful. We have gotten so much done in this community, and those council members who have been on for many years, you definitely can see the difference 2 years later. So I am just thrilled to have been able to work in this position, in this capacity. And I'm not going anywhere. I'm just going to move my chair over there or over there. I'm not sure where I'm going to be sitting. But I thank you very much from the bottom of my heart. And these are beautiful. Thank you so much. I wasn't expecting that. And so I am, though, ready to pass the baton, and we're going to get into our election of officers at this time. So in talking about the elections.
Chair Linda Lopez, before I guess we have like item number 10, which is this discussion.
No, I'm gonna talk about that. Yeah. I got my agenda. So right now, there's a chairperson, a vice chair, and secretary. Those are, per our bylaws, those are the 3 officers. In discussing this with County Council and Irving, and I believe, Mike, you were part of that discussion, the question about the secretary position has come up. Is that really going to continue to be an effective position on the council? Since it was originated because there was a time when council had to actually take their minutes, take notes, and there was a reason and a function for that position. But now there is not. We put it on the agenda to discuss it, but I wanted you discuss it and see what you thought about that. It will eventually have to go into a bylaw amendment if council decides that that is the appropriate thing to do. We're not going to do that tonight, but just wanted to kind of get some discussion going about that. Specifically, is there a role for a secretary on the council?
Well, I agree that historically, the secretary took minutes and took care of those duties, which now Irving has gratefully stepped up to do. So I think it's an antiquated officer position.
Okay. Thank you, Dale. Thank you. Laura?
Well, I agree. That was the case in past years, but currently I'm not even certain who our secretary is, so I think. Oh, that's right. Okay.
I am actually the last secretary, I guess, from the board. But yeah, I can ratify. I did not do anything.
As secretary.
Not because I didn't want to.
Right.
There were just no duties for me.
Hey, things change, so as things change, we have to actually go to the bylaws and change our bylaws. So, any other, Esperanza? What do you think?
We did it at one time, I don't know how it got lost in a way. We never followed through it, so.
Okay. And Beatrice, you were secretary previous to Ever. Do you think it's time to move on from that?
Yes, I do. Because back, like historically, it was a needed position. We felt that, the burden was on us to get things moving, to do outreach, to do the minutes, to do anything that was online. But now, things have been delegated, and so I think that position is no longer.
Okay.
In other words, we now have wonderful support from staff at the county, and specifically all of you.
So I think then we can proceed, I don't know at what point, maybe in March, to do, I'll put that on the agenda to amend the bylaws so that we get our officer categories current.
Do we need a vote on it?
Yeah. No, this was just a general discussion, correct, to get a gist for where people were at?
Yeah, I was primarily looking for a consensus, and we'll come back with an action item to actually amend the bylaws that you all can vote on at the March meeting.
Now, correct me if I'm wrong, Melissa, but we're not going to actually nominate for secretary tonight.
Yes, so my recommendation would be for item 11 that you proceed with selecting a chair and a vice chair, and that Councilmember Rodriguez would continue to serve as the secretary until March, through the March meeting, at which point you all will consider the bylaws amendment. If the amendment is passed, then there will be no more secretary. If it does not pass, you could choose a secretary at that time.
Okay, great. Okay, one more month, Ever. Thank you, Melissa. Thank you. Okay, so last on the agenda, selection of chair and vice chair. And I think at this point we can nominate from the floor. I call this the floor, but the table. And let's see where we go. I have a nomination in mind, and I'll kick it off, and then if others have other nominations, you can follow. I nominate Raphael. I think I've worked with Raphael for the last several years, and I think that he is going to be very capable and responsible to take on this role, and I nominate him for chair. Are there any other nominations for chair? Well, I'm waiting to hear if there's no other nominations. Okay, I don't hear anything else then. I will motion then that Rafael Avendano be elected the new chair for the North Fair Oaks Community Council. Oh, I can't motion. I have to entertain a motion.
I'll motion that Raphael be nominated for the position of chair.
Okay. Is there a second to the motion?
I'll second that motion.
Okay, Diane seconded. Okay. All those in favor of the motion, say aye.
Aye.
Any opposed? Motion carries. Raphael is newly elected chair of the North Fair Oaks Community Council. Okay. All right. Vice chair. I also have a nomination in mind. I would like to nominate Mary Martinez to come on as vice chair. Are there any other nominations? No, okay. Would someone like to put the motion out there?
I will move to nominate Mary Martinez for the vice chair position for the North Fair Oaks Council.
Is there a second to the motion?
I'll second the motion.
Okay. All right. Esperanza is second. All those in favor of the motion, say aye.
Aye.
Any opposed? Mary Martinez is the newly elected vice chair for the North Fair Oaks Community Council. Congratulations. All right. Wow. How do you feel? You feel good, you guys? Yeah. Good.
Excited.
Oh. Well, I didn't know, you know, when someone nominates you, you can say, excuse me, but I have to withdraw, but no, it's time, and I think you're both gonna do excellent. Now, you have all of us to help you. We're not going anywhere, okay? All right. So with that, I will entertain a motion to adjourn.
I'll move to adjourn the meeting.
Okay, all those in favor of adjournment? Okay, all right, meeting is adjourned. Thank you, everyone, for coming out tonight. Appreciate it. Thank you.